My name is Laura Robertson Boyd. I use she, her pronouns. I am the Senior Program Coordinator at the Healthy Community Center for the Ohio State University Medical Center in Columbus, Ohio. I used to be the executive chef at a small nonprofit doing healthful food education in Central Ohio. And we had students from the Ohio State University College of Medicine come to us and say, we don't know how to take care of ourselves, and if we can't eat healthy for ourselves, how can we possibly take care of our patients? So I developed my own cooking and nutrition program based on the curriculum that we taught at our nonprofit organization. That was in 2011. When I heard an NPR story on the radio about Dr. Timothy Harlan and the curriculum he had developed for culinary medicine, I worked with the medical school students and said, you have to bring this to the Ohio State University College of Medicine because you need to be able to get credit and use an evidence-based curriculum instead of my little culinary boot camp I had created for them. And so we implemented that curriculum in 2016, and I've been teaching health meets food specifically at OSU College of Medicine for the last 10 years. I will also say that during that time that I was with the nonprofit, I was kind of the chef instructor that was the glue that held all of culinary medicine together in Central Ohio. So I taught the Health Meets Food curriculum with not only the Ohio State University, but also Mount Carmel Health System, Nationwide Children's Hospital, and Ohio Health. So we actually all work together in a collaborative group to share best practices on how to implement and deliver the Health Meets Food curriculum. We would meet monthly to share ideas, and we eventually ended up producing a paper that got published in the Journal of Nutrition in 2020 on sort of a how-to guide on how to implement culinary medicine. The concept of culinary medicine really, I think, dates back to ancient Greek philosopher and physician Hippocrates, who said, "Let food be thy medicine." So I think, in current westernized medicine, we tend to gravitate towards pharmaceutical interventions as a first course of treatment. But I love that culinary medicine really takes the approach of food and healthy eating as a way to prevent or manage diet-related disease, maybe in partnership with our medications. So the idea of food as medicine is as old as time, but I love that it's making a resurgence now. And both physicians and patients are finding their way towards seeking out this nutrition intervention or healthy eating, really ways to practice how to put that into their lifestyle choices. And culinary medicine is the perfect intervention because it offers evidence-based nutrition education along with hands-on cooking skills to really help people understand how to make that relatable in their lives, how to cook and eat healthier for their families. Culinary medicine is also a way to teach the next generation of physicians how to really talk to their patients about health and diet. And I think that's so critical when Americans are facing epidemic proportions of diet-related chronic disease with diabetes, obesity-related diseases, heart disease, cancer, and so forth. So I love that culinary medicine is really a proven intervention to address those needs and help everybody lead healthier lives. Absolutely do it. So I am a chef, and I will say that when I first started teaching culinary medicine, it wasn't possible for chefs to get certification. And so I love that it's possible now. And in my profession, not necessarily a lot of chefs understand, again, the connection between diet and health, and they really need to. I think we have a responsibility to do that. So the more chefs we can get understanding that connection between diet and health and understanding how to make more healthful foods for general customers or patient populations, I absolutely encourage folks to get certified. And I will also say that in my work in an academic medical institution, I work with a lot of colleagues that are maybe not chefs and collaborate with doctors, nurses, dietitians, physician's assistants, healthcare professionals. And so I invite everyone to come to the table that's interested in exploring food as medicine or culinary medicine as another tool in the toolbox to treat diet-related disease. So when we all collaborate together, we can all make a bigger difference for our patient populations. When I started my culinary career 30 years ago, I think that was certainly the case, is that chefs were focused on making food taste and look beautiful. And we really didn't get a lot of nutrition education in culinary school, not unlike medical professionals and medical students not getting a lot of nutrition education in school. So what we've learned about the connection between diet and health over the last 3 decades has changed a lot. And if chefs still don't understand that they need to make more healthful choices for customers, then I think we can't afford to do that anymore. We have to adapt to the times. So it's not enough to tell clients or customers that they have to make healthful choices for themselves because they don't honestly know how to do that. I think we as chefs and food service professionals have a responsibility to provide the foods that people both want and need. A lot of folks think that healthy food automatically doesn't taste good. And so I really feel like our role as chefs and food service professionals is to make healthful food that does taste good. So, do we have to make food laden with salt, sugar, and fat to make it taste good? No. Is there a place for that kind of food sometimes? Yes, that's sometimes food. We sometimes have to nourish our souls and our spirits as well as nourish our bodies. But we can no longer simply just make food that tastes good. We really have a responsibility. Again, with the epidemic proportions of diet-related disease that Americans are facing, we have a responsibility to make sure that we can help folks make those healthier choices even when they're eating out in restaurants. And chefs that adopt that kind of mentality and give folks more healthful choices can then inspire the next generation of culinarians and lead the way. So when I think about my favorite ingredient or recipe, I always go to vegetables because Americans don't eat nearly enough fruits and vegetables. And again, my job as a chef is to make those fruits and vegetables tasty for them so that they will try new foods or incorporate more fruits and vegetables in their diet. So my favorite underappreciated vegetables are kale and beets. So kale I love. I think it's probably becoming popular, but I love it specifically because it's inexpensive and affordable and it's very versatile. And most folks probably haven't tried it. So I'll try it in a salad or baked kale chips, and I find that those are popular menu items or recipes for everybody from kids to adults and all different backgrounds. Beets, most people are resistant to trying them because maybe all they've had is grandma's pickled or canned beets. But I love them roasted. It brings out the natural sweetness in beets. So I'll put roasted beets in hummus. I'll put it in a black bean burger where it gives it a nice pink hue to sort of mimic the look of ground beef. And I'll even put it in brownies where it adds a nice moisture and natural sweetness, but you can't pull out the beet flavor. And when I expose folks to these kinds of foods, they're always pleasantly surprised and willing to give them a try, which is awesome.